Episode 4 of Season 4. I'm Berta Braga and I'm bringing you today a prosthodontics department case. So let's go. First of all, don't forget to subscribe our YouTube channel. It's great because you have a lot of content from literature review to some of our cases, and it's great to subscribe.
Where do you have to press it?
Here.
Yes.
Go to the bell.
Yes.
Subscribe. And it's great because you can see a lot of cases from all our team. We usually do it together, so it's very interesting for you to have a different approach from maybe your approach. So, going to the case. We had a female patient, 58-year-old. She was completely healthy, ASA1. The TMG was asymptomatic. She was very stable on the occlusion. And the reason that the patient came to us was, I don't like the way my canine stands out in my smile. So here you have an occlusion view of the case, and the question would be, what would you do? 2 ceramic veneers, only on 13 and 12, 6 veneers from 13 to 23, 1 ceramic veneer only on the canine, or 6 veneers from 13 to 23 with a flowable injection technique. And it's very interesting because the answers that you gave, it was almost 40 answers, was just in between the materials. We all agree that this case has to be rehabilitated with 6 veneers. The question is with ceramic or with flowable injection. So, looking at the smile of our patient, there is a clearly point that stands out. It's the canine. It's a very heavy weight on the photo, but if we solve this problem, then we would have other problems, as this conoid lateral, very asymmetric to this one, as the centrals are pretty asymmetric with this composite restoration, and so the patient would go from one problem to the other problem as we would stabilize the first problem of the patient. And now looking at a whole view of the patient, we can also see that although she has a stable vertical dimension stabilized with implants by Professor Shen, there are some points that are not so stable, as this lateral incisive, that in some points it can be interference on the occlusion, on the eccentric and the centric relation of the mandible to the maxilla. Here we have the panoramic. As you see, the condyles are pretty symmetric. The patient has no problem in the TMJ. And the posterior sectors are very stable and with the correct vertical dimension. Here we have the occlusion view. As we see, we have a rotation of the canine. We have a conoid lateral that doesn't even have the same space to this lateral. Sorry. And we have some infiltration on this restoration. And so we went on our smile design. This is Smile Cloud, and we choose from the library what would be the best teeth to fit this patient's smile. Okay, it was these ones. We're having some technical problems, so it's okay.
No, not right.
Okay, here we have.
Yes.
So here we have our library. These are all
Smile Cloud. Say Smile Cloud.
Smile Cloud.
Yes.
Thank you for this library.
Yes.
The patient just fitted very well the patient, and so we went from this library to our WhatsApp. And so we started with a mock-up, of course, because we have to see how would be the final result. So this is very interesting because it's a subtractive mock-up, as you'll see furthermore. And here it is. We always take a first photo of the patient, and on the same day, we just place the mock-up with the retrievable material, and we just take another photo so that we can see the real impact and what would be the real difference. And as I told you, one thing that is very interesting, this is a subtractive mock-up. So we just paint with the black pen over the tooth, and we take a photo. That way, the patient cannot perceive the presence of that tooth that is too long. The patient was very happy. We were very happy. Mariana helped me do all these walks-up. And from this point, we already decided, okay, we have to rehabilitate. But we have a tooth that is too long, so we have to cut. And we have lack of space to the lateral. And so we went to our CBCT. This is not great image quality, I'm sorry for that, but we could see that the amount of tooth that we had to cut was 1.5 millimeters. It was only on animal and just a small island of dentin. So it was okay. We were not afraid of the tooth vitality to be affected. And so Mariana designed these tooth reduction guides so that we could have the most harmony smile at the end. And so that we could also only cut the minimal that was needed. Here we have the walks-up of the final. It's very important to know that we have to do the limit, just the gingival, so that we don't have a lot of amount to go further to the gingiva. So here is the reduction guide, the reduction tooth guide. The literature says that it has to be this color, transparent, and that this would be the perfect one. It's good to see that it is well fitted to the teeth, but it's not so good to check if we already cut all of the tooth structure that we needed, as you cannot perceive if you're already cutting the guide or the tooth. But it went very well. The patient did not have any sensitivity. It's almost all in animal. And here is the final cut, as you can see. Then going to the injection, the flowable injection technique itself, it's very important to place retraction cords. We used 2 zeros. We have to individualize the teeth by using Teflon, and it's very important to be carefully adjusted, yes, to the cervical area. And then you just do the edge, and you use the bond. And when you place the guide, before you start injecting, it's very important to place the tip of the flowable composite all the way to the cervical and start to inject from cervical to the incisor edge so that you don't have any bubbles inside. Here is our final result. We went for composite, as you understand, and it's very beautiful. Just have to have very careful in the final and remove every excess. You have to go for a good polishing. We used some gums from EVE. As you can see, the contour, we corrected the rotation of the canine. We managed to have a symmetric laterals as the centrals. Here is one of the reasons why we went for composites and not for ceramic. As the patient was not interested in orthodontic treatment, we would have a bump on this lateral that in a composite, we can just retouch the composite. As long as it would be a ceramic veneer, we would have a chipping, and that would be not so predictable for us how to solve. Here we have the centric This is the protrusion, the left and to the right lateral occlusion, and this is the before and after. And thank you so much for watching. Bye bye.